Hi, my name is Pete Now. I am from the University of Iowa Carver College of Medicine. I have nothing to disclose. Gastroesophageal reflux disease in the setting of obesity is an increasingly common issue faced by the foregut and bariatric surgeon. Currently, there is no consensus on how to define and appropriately evaluate the problem in the setting of a metabolic surgery candidate. There are practices that will use subjective symptoms versus objective evaluations or even GERD questionnaires to quantify reflux. Others are using daily medication usage, 24 or 48-hour pH testing, endoscopies, esophograms, and even high-resolution esophageal manometries to define the anatomy and function of a patient's foregut structures. There are some programs that will use compulsory algorithms where everyone is obligated to have a test whether or not they have reflux, while others will use a case-by-case evaluation to determine who undergoes a formal reflux evaluation. On top of that, there's currently no consensus on the best operation for GERD in the setting of obesity for both a primary and revisional procedure. Some think that the sleeve should never be used with reflux, while others use it liberally. The role of the gastric bypass and even a primary anti-reflux operation currently have not been fully defined in the setting of obesity. There are those that will use the links liberally and others that use it very little. And there's a question of when and how often someone should be addressing a hiatal hernia in the setting of an obese population. Dr. Mahid and I hope that this session will identify the best practices for this population based on the available literature and expert opinion. With that said, we have identified 6 topics that we will hopefully address today. The first speaker will be Dr. Higgins. She will speak about the proper workup for GERD prior to surgery in an obese population. Dr. Denise G. will discuss what is the gold standard operation for an obese patient with GERD. Dr. Needleman is going to review the use of a primary anti-reflux operation for an obese patient with reflux. Dr. Thompson will review the physiology of GERD. Dr. Jorge Diaz will present on the alternatives to the standard sleeve in the patient with GERD who is really not an ideal candidate for a Roux-en-Y gastric bypass. And Dr. Ibo will review the controversial question of what to do with someone who has new onset or refractory GERD after a primary bariatric surgery. Dr. Mahid, I hope that you're able to take something positive away from this presentation. We'd like to thank SAGES for the opportunity to be involved in the session. We were disappointed we couldn't see everyone at Cleveland, and we hope everyone is safe and healthy.